Don't you know drugs are everywhere, drugs are everywhere, drugs are everywhere, you can't stop it. Criminalize and make a profit of full and so it's longevity. Drugs are everywhere, drugs are everywhere, drugs are everywhere. Hey, I'm Murph. I'm a former heroin addict, current alcoholic, and you're tuned in to Self-Medicated Weekly Dose, a podcast that's all about drugs and the people who use them. As always, this program is inspired by the harm reduction movement, informed by my personal experience using all sorts of drugs for damn near 30 years, and enlightened by my special guests. And today I got a dynamite guest coming in to join me. She's the Drug Users Health Services Program Supervisor at Outside In right here in Portland, Oregon. She's a passionate harm reduction advocate who's out there doing the work that we all appreciate so much. Please welcome to the program, Haven Wheelock. Yes, the Haven fans are in the house today. Thank you for being here. Thank you so much.
Of course. I'm looking forward to it.
Yeah. Well, we got a lot packed in. There's a lot going on in the world of drugs and drug users. Policy, there's just a lot to get to. But before we dive right in, I just want to give a little context for the guests. The first time we had met, Haven, was I was doing a live stream for Self-Medicated a few years ago, and you had joined me on that. And the timing of that was, it was right before the vote here in the state of Oregon for Measure 110. Measure 110 was, of course, a ballot measure in the state of Oregon that basically decriminalized the possession of all drugs, small amounts for personal use, completely decriminalized. And it was passed into law. This was a measure that you were very much behind and had a hell of a lot to do with it getting passed into law. So this clip was pulled from a live stream that we did right before the vote. So like late October 2020. We look very young in this clip. So I'll speak for myself. I don't want to talk shit about you, but I look much younger. I saw this clip and I was like, my God, have I aged? But life will do that to you. But here's a little clip from that live stream where we made a deal with one another, where you were working on Measure 110. And in Pennsylvania, they had been attempting Philly Safe House to open the first injection site in the country. And they met some blowback, but this was the deal we made with each other. So listeners will hear this.
We'll make Pennsylvania next. You guys get the safe consumption space started. I decriminalize, and then we'll switch.
Hell yeah. Yes, I love that.
All right. Well, one of us held up our end of the bargain.
We're trying.
Yeah. You, in fact, got it done. So Measure 110 was passed, which was very exciting. The Philly Safe House is involved in somewhat of a legal battle with the Department of Justice. So this is a federal issue that they had stepped in and said, we can't open this. This is somehow, violates the Substance Abuse Act, whatever.
Crack house laws.
The crack house laws, sure. Thank you, Biden.
Mm-hmm.
So we had the 1-2 of like Trump using the old Biden laws to try and now Biden's back in. It's like, will you right the wrongs, you Scranton Joe, for the love of God, please, finally. We'll see. I'm not holding my breath, but we'll see. They keep kicking it down the road. There's another. They were supposed to have a deadline this week, I think, wasn't it? On the yeah. But of course, as New York, not to be outdone ever by Pennsylvania, New York, of course, overshadows and opens 2 injection sites in New York City. I think there's one in Harlem, and there might be another one in Washington Heights or something. There's a couple of them in the city there. So they're just saying fuck it. So that's exciting to see.
They're very brave.
They are, and you need people to kind of step up and just say, we're not going to listen to this. But I think at the same time, if there is a ruling made in some way, that will help everyone. If there is finally a definitive ruling to say you can.
Oh, for sure. I think like this court case hanging over all of us has made it much harder for folks to know what to do and how to plan for it.
Yeah. And I feel like just as a quick aside, they're talking about 800 and some, or however, I don't know the exact number of how many overdoses have been prevented also in New York City from these 2 sites being open and operational.
Yeah, I think when I was talking to the folks out there, it's like they've been open for just over, like their 1-year anniversary was in the last 2 weeks, and it's like almost 700 overdose reversals on site. Only 9 people needed to be transported to hospital from all of those.
Amazing.
It's amazing. Like when you are intervening on an overdose early and catch it early, it's very different to respond to than what we're doing now. So like the ability to just like give oxygen support as opposed to Narcan, which if you have an opioid habit, you prefer oxygen to Narcan.
Sure. Yeah,
many reasons. So it's amazing to get to talk to their teams and see the work that they're doing in New York. I'm so proud of them, and
Yeah, as anyone who's been brought back from Narcan knows, it's a little bit of a, you're instant withdrawal situation. So it's a hell of a shock to the system. That is interesting with the oxygen. I didn't even know that. That's
better than dead, but
yeah, sure. And these are of course, these are the kind of sensible things that you start to figure out where you're just like, it's funny that you need a real world application to point to. You need some sort of data set that'll still be like poo-pooed by the people who are really hardcore against it. But it's funny that you need that where you're like, well, no shit. Like you're like, oh, these places opened up and they saved some lives. You're like, yeah. That makes pretty much all the sense in the world. I didn't need to actually see that to be operational to assume that.
Like, and to throw out there that like we have 30 years of fucking data on this stuff, right? Like it's not like yes, these are new in the United States, but we've got plenty of data that shows that this is what happens when you open these things. But because of American exceptionalism,
yes,
we're only now paying attention.
That's right.
New York is doing it,
and we'll take credit for it too. When it does finally go wide, we'll be like, oh, and America was the founders of these sites, and which whatever, if that's what we're gonna do, fine, let's just get them out there.
Right.
All right. Well, let's dive right in. Our first segment here is the substance report.
This is the question: do junkies' lives matter?
What we do here, Haven, is, the mainstream media's narrative on substance use has always been trash. We know that. And so what I like to do here, the Weekly Dose, is I like to take some of the top drug-related stories in the news and give them some proper coverage, a little bit of more context and a little bit more nuance than you get from general media outlets. So the first thing here I would like, well, we already talked about this a little bit. This is just from the Philly Inquirer. This is just following up on, it says, after another delay in a decision on supervised injection sites, Shapiro says he still opposes them. So this is another thing that's difficult because this fella here, Josh Shapiro, was just running for governor. He was the AG in Pennsylvania. He made kind of his claim to fame by doing a bunch of busts on the opioid. The manufacturers, the pharmaceutical companies, got a lot of money coming into Pennsylvania. But unfortunately, he's saying he can't use. Not only can you not use any of that money to fund some of these sites and other harm reduction interventions, which I think Rhode Island, there's a state that's like really also being like, fuck it, we're doing it. We're using the money from the opioid settlement to fund, injection sites and whatever as people are open. And so this is unfortunate because Shapiro was running against a Christian nationalist. So it was a tough, in that race, you're always with the lesser of two evils. So this is what we're left with. Mastriano, I believe his name. He was a loon. So at least we still got, don't have him in the driver's seat, but Shapiro's got to come around on this because I feel like, again, the evidence is there and it's like, I don't know what the pushback is, but this is where we're at. So thanks to Philly Safe House, the folks still fighting that. There's a lot of NIMBY stuff. And I wanted to ask you, Haven, what do you feel like? Is it bureaucratic or is it like what is the first push? Because it feels like they had this, they opened this kind of. Philly Safe House had a soft opening before there was a lot of pushback from the community. And I know there was some grumblings about, well, they could have handled talking to the community first better, so there might not have been as much of a pushback. I don't know if that's true. I lived in South Philly. I mean, look, man, there was like, there's a lot of, when a Rite Aid opens, there's a lot of opinions where there's an opinionated group down there. So
I was just in Philly last week, actually, for a conference, and I got to see Shapiro speak. Yeah, he's very proud of how many people he puts in prison.
He is.
He's very, very proud, even to speaking at a public health conference where the audience is going to be health focused. He was still kind of bragging about all the people he put in prison. There might have been someone booing in the back of the room. Whoever it was had a mask on. I couldn't tell.
Who could say?
I couldn't tell.
I've never heard you boo, so it certainly wasn't you.
No, I don't do that. I'm very polite.
What if know your audience? You know what I mean? Like it feels like that's the out of touch thing where it's like, listen, man, these are people. Yeah, public health folks are all about healing and helping, and prison does not do that. We know that. So it's funny that's what he kind of ran on.
Yeah, I mean, it's not though, right? When you think about like his lens, right? Like when all you have is hammers, everything's a nail or whatever the hell that's right. Like that's right. Thing is, right? Like, and if his lens and his framework and his scope is like punishment helps, he's been indoctrinated into thinking that like safety means incarceration. And so it doesn't surprise me to hear someone with that lens speak that way.
Yeah, you're right. No, you're right. And who would be the, AG? Like, you're not going to be the attorney general if you don't believe in that. Yeah, wielding that paddle, like a big daddy trying to spank everybody who's naughty and keep them safe by grounding them and putting them. And we can make fun of that, but in reality, as we know, the prison industrial complex, that whole once you're in that, that's no joke. That's no grounding at home from daddy. That's fucking ruining people's lives and tearing families apart. So,
yep.
Yeah, I mean,
it
again,
costs a lot of fucking money.
Yeah, it does. Yeah, it does. And Pennsylvania is a tricky, it's a state that I feel it's pulled in a lot of different directions. But like I said, even in South Philly there was a lot of NIMBY pushback on this stuff. But I do feel like it's going to take, it's certainly we got to get past this idea where you're they funded Mastriano. They propped Mastriano up as the candidate to run against Shapiro for governor. So, because they were this guy's so wacky, we got it in the bag, which he got a hell of a lot more votes than I think people were comfortable with. And at the same time, that just positions them to not have to really move in any progressive direction towards this shit because they're well, you want to give me a bag of shit, you better not, because then look who's waiting in the wings. So it's this two-party nonsense that keeps us, just begging and thanking people for not, being as, a full-on Christian nationalist. I'm well, if that's the standard that's been set, then Jesus.
I mean, we talk about two-party systems, but then our third-party candidate here in Oregon for governor didn't do us any favors either.
No, she did not. What a strange, what a three-way tango that was for governor out here. Yeah. Well, let's actually just get into that, because what we have here in our other, the more, partially at least uplifting story, actually very uplifting, that you did in fact get 110 passed. But we'll look at this article here. So this was now 2 years ago that 110, and this kind of right on the heels of what you're saying with the governors, because they had a lot of opinions on 110 in its infancy here. But this bit here is comes from a local ABC affiliate. It says local law enforcement blames Measure 110 for the rise in fentanyl and synthetic opioid overdoses in Oregon. So what's funny about this is just says Sheriff Dave Daniel, they spoke to this county sheriff, says Measure 110 has affected the community since its passing. He's seen, so he's just basically being fentanyl overdoses are happening. There's a lot of drug use, blah, 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 which of course, you can immediately dismiss this as logically, at least we can dismiss this. And then we'll get on to what really matters to people. It's just not the logic. It's certainly the emotional weight of this. But let's just talk about the logic really quickly here, is that in PA, where we just talked about, we love our drug delivery resulting in death charges. We got some old shit on the books that we throw around that is terrible. And yet, what the hell? Fentanyl's ever. People are still, overdosing. People are still using drugs. So it's funny to just pull this up as the reason is because of 110, not well, that's just true all over the country. It's true that the rise, these overdoses and fentanyl. So it really, whether you can take draconian measures and old school, iron fist stuff to deal with this, or you can 110. It's just funny that local law enforcement's trying to blame this, which I think is also what some of your gubernatorial candidates were floating as well.
Yeah, I mean, and it's just blatantly not true,
yes.
Right? Yes. Which is if it was, we are seeing a increase in overdose death in Oregon right now. We are. Fentanyl, yep. I've been working with people who are using heroin and methamphetamines for decades now here, and I will say, Murph, I've never seen our drug supply change as quickly in my entire career. I've never seen the way people are doing drugs. People are switching from shooting heroin to smoking fentanyl, right? Our number of exchange clients bringing us our syringe injector clients has decreased significantly because people are turning to smoking. And this increase in fentanyl, of course, we're going to see an increase in fentanyl related deaths at the same time. And when you compare what's happening here to what's happening in, say, Seattle or San Francisco, it's the same. Neither of those places decriminalize drugs, nope. But they're seeing the same rates of increases because our drug supply has changed so quickly.
Yeah, that's right. It's a false equivalent. You can't say one with the other, because exactly like you just said, you're seeing the same thing. It's a poison drug supply. Exactly. That's the main. Mm-hmm. The main thing being and standing in the way of that as well. Even here, at least Measure 110 is available, but not having the resources, which I think again was a big problem with 110, which surprise, surprise, the bureaucracy took forever to get the funding, which was the other big part of this. That's yes, of course, decriminalize immediately everywhere, obviously, but to then say that if you're trying to address some of the public health issues, you need then the resources to back that up. Otherwise, people won't be in jail or be getting arrested, which is of course huge, but you're not going to really make any sort of other impact outside of if you don't have the resources, which go well beyond just like fentanyl testing strips, Narcan available, injection sites, housing, employment, like all the other things that you get into the core causes of all this are essential, obviously, in the long run. But in the short run, that's why I think Measure 110 was amazing, because you're like, we got to start with what we can immediately, put an end to, which is the everyone getting wrapped up in the criminal justice situation for this.
And that money's coming, right? Like that money is just rolling out. And, when you think about how much money is coming into our system because of Measure, $300 million worth of cannabis revenue, ongoing investment in this system is just now starting to roll out.
And that was the brilliance of 110. I feel like that being tied to that was the whole idea from the beginning, right? Was that this would pass with the cannabis, since there's, the dispensaries are out there. They're selling weed in the state. That's a huge source of revenue. So tying that to that is exactly what needs to be done.
It's one of the only, as far as I can tell, it's one of the only sustainable funding for harm reduction services in the country right now. It is dedicated funding and investment in these kinds of, and the long-term services too, which is pretty dope. Yeah. If I do say so myself. I'm very excited. And it's I'm really seeing some of the organizations that are getting funded with this stuff, organizations that have historically just been excluded left and right? Like Black and brown, culturally centered organizations getting for once getting what they need to really do some cool ass work.
Yeah. That's exciting.
It's going to be bananas to see what happens over the next couple of years.
Yeah. Yeah, it really is. And I think that holding the line on that is important, because I saw some, just being here, I just moved since we last spoke, when I was living in PA, I moved out to Portland. So I'm here in Oregon. My wife is originally from here. So we've been here for almost 2 years now.
Welcome.
Thank you. But yeah, seeing the talking to people, kind of, it feels like there was a sense with that delayed funding of people kind of being like, well, I voted for 110. Yes, I want, but I'm kind of being like, well, it doesn't seem like anything's getting better, or I'm worried that, with whatever sort of crime, which again is always, well spun by the media on crime stats and how that works, has always been easily manipulated to fearmonger. But regardless of that, it's some people saying, in my neighborhood, I see people that I think would want to be helped, but it seems like, why are they still not getting the help, whatever. So trying to be like, hey, just hang in there. Money takes, for it to go through hands. Everybody's got to, have their hand in the cookie jar there on that when the bureaucrats are concerned. But however that works, it's a huge amount of funding is coming and is available for people, like you said, in programs that normally were not well funded, and in communities that are generally, left out in the cold on this kind of stuff. So I feel like that's very exciting to see. And I think public opinion from the polls I saw are pretty much what it was before 110 was passed. Mm-hmm. So people aren't, being duped by the quick, knee jerk from some of the gubernatorial candidates in the media of just being like, well, it didn't work. See, we tried it and it's fucked up. It's all worse. And you're like, well, first of all, 2 years into anything, it's just pump the brake, just relax for a minute and let it play out.
There was also this respiratory pandemic that happened.
How about that? Yeah, right. At the time, yes. It might have
taken us 100 years for this shitstorm to get this bad. Thinking it's gonna miraculously be fixed in 2 years when there's a respiratory pandemic and that caused increases in houselessness, increases in everyone's nerves being shot.
Yeah. Yep, that's so funny. Yeah, that is funny. That factors in for sure, but they don't mention that. There's this whole other that's weighing on a lot of the public health systems and on their resources. I think another funny thing is you're also you said this, but it's 50 years and trillions of dollars or over $1 trillion on this drug war that didn't work. So it's funny too, you get 5 minutes here with 110. It's well, it doesn't work. It doesn't. You're well, how about $1 trillion in 50 years and we'll see if it works. And then we'll look at the two and be like, which one worked better? But yeah, that's funny. All right. That sounds like a reasonable proposition. So hopefully, and congrats again. I mean, it's it really is a monumental thing. I know as a drug user and a lot of drug users I was in touch with. It was kind of like people who weren't maybe as dialed in to knowing that this was even on the ballot. But as soon as they heard about it, everyone's like, holy fuck, did you hear about like Oregon, they decriminalized? And they're like, yeah. They're like, no, everything. I'm like, no, I know. It's amazing. So everyone's very, very excited. And hopefully it just rolls across the country and slowly gets, everywhere, the idea of it. Before, kind of the media shits on it enough that people are like, well, it's not working. But I think people are wise to that. It seems like people are ready for, and we will start to see some, with the funding there, we will start to see some really exciting advances.
Yeah, I mean, I think, like, I'm unnervous at this point, like, nationally, that the appetite for, like, I feel like as a country, we're, like, swinging back a bit more towards, like, law and order rhetoric around shit, which makes me nervous. But I think we're, like, Baltimore is a great example of a place that, like, de facto decriminalized due to the respiratory pandemic. And, like, the data on what happened there is, like, just starting to come out. We've got major research projects happening around Oregon's decrim as well. So, like, we are actually, like, evaluating whether it worked or not.
That's exciting. So there'll be data.
Less people in jail is working.
But, imagine that.
People like data.
People like data. They do. They do love it. And in the absence of it, they'll just make up their own. So we do got to kind of get some good data out the door on this. Will be exciting for the rest of the country to kind of go off of. Well, let's slide over. We have another segment here. We go from Measure 110. I'd like to talk a little bit now about Measure 109. And this is in a segment that I call Fog of Drug War.
War. It's fantastic.
So as I mentioned before, the drug war here in America, in its modern form is, we're going on 50 years, over $1 trillion spent. With that kind of, war rhetoric and campaign, there's been a lot of strange, as in any war, there's a lot of things that come up, moments of confusion and of just like, what the hell are we doing here? What's going on? And there's been no shortage of that throughout the course of the war on drugs. So I like to highlight some of those moments, some of the more, just interesting, silly, bizarre, falls into a lot of different categories here. But this one in particular, since I had you on, I'd love to talk about, because this was just a little, it was wild to see, and I'm sure you've heard about this. But I'll just play this little clip here. This is from the local news here, just explaining to the listeners what took place over the last week here in Portland.
Portland police raided Shroom House on Northwest Burnside around 1 o'clock this morning. They seized more than $13,000 in cash and then more than 22 pounds of psilocybin products. Officers also arrested 4 people. Police released a photo of the drugs they confiscated, including 4 bags of dried psilocybin mushrooms. Over the past week or so, the controversial storefront has attracted all kinds of attention and long lines of customers trying to get inside. Shroom House didn't seem to hide the fact that it was illegally selling psychedelic mushrooms either. Oregon's legal psilocybin program, created under Measure 109, allows people 21 and over, they will be able to take a substance in a regulated clinical setting when it takes effect next year. But the retail sale of psilocybin is not allowed.
All right, so this is a very funny, because I stumbled across this. I don't know if it was Reddit. I don't remember. Someone sent me a thing that was kind of being like, yo, you gonna go down to Shroom House and buy some shrooms. And I kind of saw this. I would just hit up the Reddit thread there on it. And it was a lot of kind of all over the place, but then I was like, oh no, it does sound like there's lines around. And then they, of course, the news gets there. They do a couple little pieces on it, which is poking the bear of this idea of like, well, are the cops, is anyone going to do anything about this? We did an investigative, deep dive. I'm like, great. You walked down to the fucking place and you took some, photos of people and video. But basically what the hell, what is the, cause it seemed like they weren't going to do anything for a while. And then they're like, well, with 110 plus the other weird thing about this is they were asking for 2 forms of ID to buy shrooms, which was an interesting, where I was like, this seems like maybe not the move, but with 110 in place, I doubt they'll go after anyone, but who knows with this Portland police, they're a hell of a criminal operation they're running there. So I don't know what they're going to do with any names that they have of people, but essentially with the people who ran it were the ones who were arrested to start. So what the hell happened here?
I mean, I think somebody was trying to make a quick buck, right?
Right,
like they knew
they crunched the
from
numbers. Yeah.
Yeah, they like from the jump, they knew that was not legal, right?
Yeah.
It's not legal under 109. It's not legal under 110.
Yep.
I think actually it had the potential to really harm both initiatives.
Sure.
If they let it stand.
Yes.
In general, so
public opinion of that for
never
sure. Yeah.
Yeah. No, I mean, I did see it as something. So many people sent me so many. I saw that story from many folks.
Yes.
Yeah, I think they were just trying to make a quick buck. The funny part of this story, though, in my opinion, is like the original Oregonian article talking about how the cops were like, it's on OHA. And OHA was like, yeah, no, that is not what we do. Because the Oregon Health Authority does not. And so like that, like finger pointing stuff of who's going to do something, like everyone knows it's not legal, but who's going to move on it to me was really freaking funny.
That is very
like
funny.
Everyone, like, it's like clearly it is not legal.
No, that's clear. Yeah, the reach is selling openly without any sort of license. I mean, even from cannabis, even if you open a weed in that pop-up fashion, that's still not, that, like there's still other ways you got to kind of go through to get things, a dispensary up and running that they didn't even.
I mean, and they want you to pay your taxes.
Right. Yes, that's that's
like,
what's funny.
One of their things they're getting charged with is tax evasion, right? Like, you can't
always
just open a business and not pay your taxes.
No, and that's the one they'll get them on hard. That's the one they always get. The IRS will never. They'll always hit you with the taxes for sure. It's so funny. You're right. The finger pointing is basically just like, well, then you almost want to be like, if you're Oregon Health, you want to just be like, well, hey, why don't you just give us all your funding to the police? Why don't you just step aside on all matters and we'll just take care of things? Because if you're going to finger point, like this is on you, then it'd be like, well, give us your resources, give us your funding. Well, you guys can go on the couch and stay at home, and we'll take care of pretty much of most issues in this. But yeah, that's funny that they're pointing the finger of like, this is on you. Like, what are we supposed to do about this?
Yeah, like what? Like, yes, they are working on like figuring out how to legally license these things as medicine.
Yes.
Right? Which I don't actually like love in general.
No,
right?
Of course
like,
not.
I get the like medical versus recreational thing that we tend to do when we talk about drugs. Is how we rolled with cannabis and all of that.
Yep.
But like, all that does is set up a system where people who have money get to have access to these medicines because Medicaid insurance ain't paying for it.
Nope. That's right. It sets up another hoop to jump through that has a cost attached to it. So yeah, that I felt the same way.
And another system where like people with money and privilege get to have access.
Yep. Like if you got to go to a doctor, that's a privilege.
Yeah.
Sadly.
Shouldn't be, but
no,
welcome to capitalism and the U.S. medical system.
That's where it is. Profits over people. Yeah. If you're selling, if you have a barrier up for medicine and healthcare, then yeah, that's going to extend to everything, especially any sort of substance. Mm-hmm. Yeah. I felt the same way about the psilocybin thing. Is like, I guess 109, they'll be licensed and you'll have to say, but that's always been like, that's what sets up like the weird dichotomy with like the opioids was always like, well, what about the people who, and then there's no solidarity between, let's say, patients who have chronic pain patients and like people who are taking opioids for whatever fucking reason. Again, it's like you're legitimized. There's legitimate pain and then there's not legitimate pain. And if it's like, well, if you have from a doctor and it's something physical on the back, then like maybe, but if it's emotional pain, if it's any sort of like, then you're like, no, you can't take any of these drugs. These are for whatever. So it sets up a whole like, shitty dichotomy between people who use these drugs to begin with. And so I think the same with psilocybin is just like, what in the world are you going to go to a doctor that they're going to tell you to be like, this is the kind of thing, because of course it works for some of those PTSD and depression and anxiety and like all these drugs. Ketamine, we're
really
seeing it.
Good.
Yeah, for sure. No, there's no doubt that it works for that. But then again, like you said, but then recreation, then it becomes, no. That's if you're just taking a trip to enjoy.
We can't have people having pleasure, right?
Oh,
We are
Lord,
a
Lord.
puritanical society
Yes.
where pleasure, especially some people's pleasure, right?
Yes.
Like,
yes. The pleasure of some is forbidden.
is right. And so where do we get into all of this? I am thankful in setting up 109, they're being a lot broader with who can trip sit for these things than I thought
good.
they were.
I was fortunate enough, maybe not with some of the acid, but when I first got more into mushrooms, I had someone selling me mushrooms who was big on set and setting and kind of, an old deadhead who, traveled with the dead for a long time, was like, just settled in and was like, hey, I'm selling mushrooms here and this is what I do. And I'm going to explain to people who buy from me, this is set and setting, this is a thing. And so that's helpful, I think. So you talk about people I think it is good to know what it is you're getting, even when it comes to that. How potent are these? What strain is little things like that? I think go a long way, which will come with the somewhat regulation or at least some oversight over it, rather than just like with any other drug. Buying when you don't know what the hell it is you're buying it's not going to stop us from buying, but it's not it's not helpful.
I mean, there's a reason we label food products, right? So you know what's in
Sure.
them.
Sure.
Right?
Yeah. If I'm going to eat a pickle, I want to know I'm eating a pickle and not a hot dog. I don't know.
If you confuse a pickle and a hot dog,
You know how I'm confused. Yes. That's you got other issues, I think, other than your dietary. Yeah, no, I don't know how I'm confusing pickles and hot dogs, but they're both the same shape. Well, that's 110 and 109. And I just want to thank you again, Haven, so much for your work on 110. It's fucking awesome. We're very excited to see how that
probably the
goes
coolest
moving
thing
forward.
I will have ever worked on in my entire life. It's like the hang my hat on the thing.
It's a big one.
No, if I do something cooler, watch out, world, because I can't think of what it might be right now.
Hell yeah. Well, let's dive into something a little funkier here. This segment, I think of, I was a child of the 80s, and I feel like back then was kind of the heyday for anti-drug PSAs. And when I think of the 80s, I don't just think of public service announcements. I also think of PSAs being propaganda, stigma, and ALF.
Losers are users, so don't use drugs. Don't use drugs. Ah!
This one actually technically isn't from the 80s. It's from the 70s, a little older. But I found this thing, and it's pretty remarkable to me. I can't believe there's something called a heroin hotline that was established back in the 70s. So this is a little PSA that was going around nationally during the Nixon administration. So let's just take a look at this real quick. This also has the grittiness of like a Martin Scorsese, Sidney Lumet, New York. Like the feeling of this is very cinematic. So it's an exciting watch.
Heroin. It's the reason you put bars on your windows. The reason you've got a big dog. Heroin. Heroin. Why nobody feels safe. Heroin. Get the pusher off your block, out of your life. If you know a license plate number, a street corner, a description, anything specific, call the National Heroin Hotline, 800-368-5363. It's a free call from anywhere in the country, and you don't have to give any information about yourself. Only him. Fix the pusher. Call Heroin Hotline in Washington, D.C., 800-368-5363. It's run by the federal government.
It's run by the federal government.
Yes.
Because that gives me a lot of confidence.
That's
knowing
right.
Who was in office.
Right. I'm glad. Yes. No, this is during, the Nixon administration. I love, it's run by the federal government. It's great because at least for me at the end, if I'm half listening to that in the other room, assuming I'm alive in the 70s, and if I was, I'd likely be using heroin in my younger years as I was here in the present day, or in my present time span of life. But I feel like I would hear that in the other room, like, oh, heroin hotline. I might just pick up the 800 number and be like, let me just grab some heroin on delivery. And then I go, no, it's run by the federal government. Thank you for letting me know. Otherwise, I would have just called it, looking for dope. So this thing here, this was a real thing, believe it or not, an 800 number nationally that people were told to call. So there was Agency of Fear is a great book by Edward J. Epstein, but in there he talks about this, the audit that was run after the first 3 months of calls received over this hotline. So there were 33,313 calls that came into this 800 number in the first 3 months. And they were evaluated by narcotics agents. Over 28,000 of them were deemed useless, either obscene calls, pranks, or simply heavy breathing over the phone. So some pervs, you got pervs calling the heroin hotline. You got to love that. Pranking the hell out of them. Most of the remaining 5,234, whatever, were appraised as sincere, but of no immediate use. We're like, yeah, no shit. That seems like a ludicrous thing. Yes. So that was a publicity stunt, obviously. Ehrlichman and some of the people in the Nixon campaign there, they loved the war on drugs. So this was one of those things where they were pointing to be like, hey, you know Nixon's tough on drugs. He's got a phone number. He's got a goddamn hotline that you can call if you see something going on, which is like, I feel like I would have had some fun prank calls on that 800 number.
I mean, I would have definitely made some calls to said hotline just to,
Jesus, yeah.
Ask a whole bunch of like ridiculous questions for a ridiculous amount of time. But I mean, truth be told, like that kind of messaging, like that's the DARE campaign was all about convincing kids to rat on their folks and their that was a huge.
That was.
I mean, I don't feel like the DEA does as much of that anymore, but like they still put out like all kinds of weird messaging that's like, we're not trying to like get the person who's addicted to drugs. We're just trying to get the people selling them.
Yeah. Yep. But they're like, but you know, the people who are addicted might be able to help us get the person. So if there is someone you know who's addicted, that's the idea there. Is like anyone who's around drugs or, in possession of drugs could be helpful to call local law enforcement or local. The DEA still, the messaging from them, they're a little savvier in terms of, you're right. They don't do the as ham-fisted as they were in the 70s and 80s, but like it still is the same kind of bullshit. They're the ones who started the narrative for local cops overdosing by being in the room with the ghost of fentanyl. Even just like,
I promise, I hold fentanyl in my hands on the regular, and I don't even get high.
There you go. Did you hear that? Yes. Not even high, let alone.
I don't even get high.
No, that's not how it works.
Worry I'm going to overdose, because that's not how drugs work.
No. I tell everybody, like, look, you got a bottle of Jack Daniels at home, pour it on your feet. Do you get drunk? No. Well, that's because that's not how fucking booze works. That's not how that chemical, that compound works.
I mean, yeah. If you could get high just by touching drugs, no one would shoot drugs.
No. Why would you go through just touch? I mean, the way they got people spooked on this, it's like you just need to be in the same room as it, and it's just in the air. I'm like, geez, if it was that easy to get high, we'd all just be sitting around in a fucking room. Just buy one bag, throw it on the table, everybody's sitting around, and you just get high, and then you can leave. Yeah, no, it's nonsense. And that's a DEA. That was no accident there that they started. Because they have their monthly, or quarterly, whatever the fuck, to local law enforcement. They send out these newsletters and everything. And that was a big one that they started, like just to be like telling everybody locally, look out for this fentanyl. If you touch it, if you can breathe it in, you can do all, which again, it's like they show, videos of the goddamn you got people in hazmat suits, like responding to overdose calls, which is again, dangerous because then people who are at home with a friend, a family member, a loved one, maybe overdosing, then all of a sudden there's pause there to help somebody. Yeah. Because people are like, oh, who cares if they're full of shit? I'm like, well, who cares is the people who are fucking dying because of this.
Yeah. And I mean, and that's the thing, right? Is like how many, like the number of conversations I have to have with like normies about like some of this like propaganda around like, you can still like, what if somebody has fentanyl on their nose when I try to give them rescue breaths? It's fine.
It's fine.
Just
it's totally
breathe
fine.
For them.
Just yes.
Right.
That won't get you.
It's not, but it is dangerous messaging, right? Like I was just hearing the other day, someone's like, TriMet's pushing to add more cops because of fentanyl on the buses. And like, like that is, it has policy outcomes. So we have this kind of rhetoric, like.
Yep. And it's just as easy. It's just like, just pivot and be like, they're going to put more Narcan available on the bus. Like they'll put a little, just like, you got in like certain like restaurants and stuff where they'd have like how you do CPR, have a little kit, put a kit on the bus that'll tell people how to fucking give somebody Narcan and how to, identify the signs of overdose. Which aren't like the signs of overdose, which actually aren't breathing even heavier and having a panic attack, which is what happens to these cops when they allegedly overdose too. It's like, I always find it funny. A buddy of mine is an EMT, but mentioned this is like, it is funny for when they come to the hospital and like, there's these cops showing up being like, we're overdosed. And the nurse is like, oh, okay, you're overdosed. Like, all right. Like, cause they know where they're like, hey, give them a little Narcan. They're like, whoo, they have this little like empty Narcan thing where they like shoot up their nose. Like, hey, there you go, buddy. On your way, little guy. Here's a lollipop. You overdosed.
Little placebo.
Yeah. It's funny because obviously they're all somewhat working in tandem to some degree with the frontline workers and stuff. So they're obviously not going to call them out hard, but it is funny to be like when they show up and it's like, somebody's coming from the police, from the cops again. They're saying they overdosed. It's funny to watch, but it's unfortunate.
But when you also throw in that though, like the healthcare resource, right? Narcan's not free. Like
No,
it's $150 a box.
Thank
right?
you.
And so you're wasting
alleged,
that.
There's an alleged shortage. That they say, there's a shortage in Narcan. I'm like, well, good thing cops are just pissing it away. They're like, we Narcaned him 5 times. And you're like, it finally worked. I'm like, you didn't need one. Not one wouldn't have worked. So you pissed 5 fucking doses away. It's like, yeah, you're right. That's this forced shortage, of course, as things always are, but the artificial, scarcity. But there was one, and that means it's more expensive. So yeah, if they're using that on themselves when it's not necessary, it's like, Jesus, man, that's.
I mean, I've heard conversations, and I don't know that this is true, but like I've heard people be like, yeah, I'm going to Narcan myself preemptively before going. Like,
no.
I mean, again, if it was like, I mean, it's not going to hurt the individual, right? Like I could shoot some Narcan up my nose right now. I once accidentally like hit myself with an auto injector while I was like playing with it to show it how it works. And it was the real one, not the like fake one.
Yep.
But it's not going to hurt them to do it. But when you think about like the rhetoric, the money, like, in these times when like hospital staff are spent, they're all like, I don't know anyone who works in a hospital, who works as a first responder that isn't burnt the hell out. And to like have them have to respond to these kind of like clearly fake shit, it has a cost more than it just being funny.
Agreed. Yes. We can laugh at it. Yeah. Not being on the front lines of an emergency room and being in a system that's already like spread so goddamn thin. No, it's no joke when they come in. And of course you have to prioritize because when a cop comes in, it's, we got to make sure this cop's over. So yeah, they start bringing 3 and 4 officers and like, another officer who helped him because he got it. He caught fentanyl. And then as he was overdosing, another cop came, wasn't in any of the vicinity of any of those other drugs, but was in the vicinity of this cop. So now then he caught it. Now all of a sudden he was overdosing, and you're like, then there was the dispatcher heard them on and then he started overdosing. It's like we're sending in the whole force, and the dogs. We're sending them all in. We need Narcan. We need all the Narcan available. Yeah, it's really unfortunate. And I feel like you see the mask off for some of these police chiefs and sheriffs and stuff where they just go like, listen, this isn't our fucking job. Like you're asking us, these junkies are overdosing. They're going to be overdosing again next weekend. Then we got to go now we got to deal with these. And I'm like, look, no one's asking you to deal with any of we actually don't want you to deal with this. So what do we have to do here to get you? Like, if you don't want to fucking deal with the junkies and you want to throw them in the gutter or whatever, then get the fuck out of the way. And you shouldn't be involved in any of these calls or any of these drug related, situations. Let's just keep you out of it entirely. We're cool with that.
I never am sad when the cops don't show up to an overdose I'm reviving.
No.
Right? Like never once have I been like, oh darn, the cops
I wish they were here.
Show up.
Yep.
Right.
I wish they were here with their little follow-up, their like Blue Angel program thing or whatever the thing is where you're like, no, listen, we won't want you to like go to, but we do need you to show up to like sign up for this thing. And like, we will show up at your apartment like in a week to make sure that you do, like, there's like weird programs like that where they'll give people, that they put them on it's like, well, we won't arrest you now, but we will, we do need you to follow up and do it. It's like, yeah, no, you don't want them. They're never missed from the scene. But again, like I said before, maybe we can then kick some of those resources. Maybe you don't get as many bulletproof shields or a new helicopter. Whatever the fuck. Maybe you kick some of that funding the other way, and we can have you off of the front lines. You'll never have to show up again. We'll see.
I would support that.
Yeah. But in the meantime, try the Heroin Hotline. Whatever that was, 800 number. And while you're at it, you can call the hotline for the Weekly Dose podcast. If you have any thoughts about anything we're talking about here, or just drugs in general, you can call 443-MK Ultra is the phone number for the Weekly Dose podcast. That's 443-MK Ultra. You can call that anytime. Leave a voicemail. Maybe we'll play it on the program. Well, Haven, in the meantime, I'd like to move into our next segment here to get to know a little bit more about you. I think our listeners might be interested in some of your answers to in this next segment. This is called Inside the User Studio. We end our podcast session with a weekly dose version of the questionnaire that was used masterfully for 24 years by the great James Lipton inside the Actors Studio. And the first question is, Haven Wheelock, what is your favorite drug?
I mean, I have a lot of favorite drugs. Probably caffeine
Ooh,
will be high on my list, because without it, I might die. Actually, you don't die from caffeine withdrawals, but in general.
This is metaphorically speaking, of course.
I might kill someone without caffeine, though. I'm not pleasant before coffee.
That's literally true. What is your least favorite drug?
I hate cannabis.
Ooh, no to the cannabis. I know a lot of people not down with the cannabis.
Yeah, the politics, the policy, it's not my friend. I get asked about cannabis a lot. I talk about cannabis a lot.
Sure.
Cannabis is boring.
And there'll be people out there who say, oh, well, you didn't find your right strain yet. Look, some people just don't like cannabis. Enough with the strains already. Maybe there is no strain out there. There's not a strain for everyone.
I don't like it. I've tried lots.
Yes, no lack of trying. What age were you the first time you found yourself under the influence?
I like caffeine from the beginning. I got in trouble in middle school for elementary school for snorting Pixy Stix.
Yes.
So I don't know, does that count?
I mean, certainly. They're under the influence of sugar, one of the grand drugs, one of the grand legal substances that hook kids from a very young age. I also did a few bumps of Pixy Stix myself. I'm not going to lie. They've been there. It didn't do much.
It's painful.
It stings like a son of a bitch, doesn't it? Much better to take on the taste buds. The sugar tastes much better than it does in the passageways. What is your favorite slang word? I know it's not your favorite drug, but what is your favorite slang word for cannabis?
Reefer.
The reefer madness. What celebrity's overdose death has had the most profound effect on you?
Ooh. Truth be told, I deal with so many overdose deaths in terms of people I care about and friends of mine who have died and people in the work and in the movement. The harm reduction movement has had a lot of losses in the last decade. And so I find it really hard to prioritize celebs when people like Dan Big, who is the father of naloxone, died.
Yes.
Right? So
from Chicago,
to me, that question is real hard.
I hear you.
I mean, I was doing an all-day naloxone training for a bunch of doctors the day it came out that Prince died from fentanyl. So that was a memorable moment. But I think instead of celebrating celebrities who die, I would rather call out some of my own heroes who are also no longer with us.
Hell yes. That is a wonderful answer. What drug would you like to deal for a living?
Oh. I mean, I've been accused of dealing naloxone a few times.
The naloxone peddler herself.
I mean, there was a Proud Boy here in Portland who had a hot moment of flyering downtown, calling me the Grim Reaper of Portland, the mother of naloxone.
Oh my!
Yeah, that was cute.
The Proud Boys have got on the anti naloxone train. That's good to see. That's nice.
Yeah.
Yes.
If Proud Boys are protesting me, I'm doing something right.
That's the truth. Yes. If you're rousing the fascists up and out the door, then you're doing something right. Mm-hmm. And what drug would you absolutely not like to deal under any circumstances?
I'm sure I'd be a really shitty drug dealer in general.
Yes.
I think I would be a terrible, terrible drug dealer. So probably none of them, because I would make no money and I would starve to death, because I'd be like, oh, I'll share my drugs with you.
Yes. Yes. Well, you must be a ruthless capitalist. And finally, if heaven exists, what would you like to hear Dan Big say when you arrive at the pearly gates?
Fuck yeah, bitch.
Yes.
I want Dan to be proud of me. So, yeah, I mean.
Yes. I have a feeling he would be.
I hope so.
Haven Wheelock, these are your drug uses. That was wonderful. Thank you so much for playing along with my half-assed James Lipton impression. So is there anything else before we go? I'll let you get going. Is there anything else you'd like to say? We're going to put Outside In, you want to maybe tell us just a little bit about the organization? Because I'm going to put a link for the fundraiser in your episode here. But what would you like to tell folks about Outside In?
I mean, Outside It is badass. We've been working in the Portland metro area, providing healthcare and homeless services to homeless youth since over 50 years now, forever. We are one of the oldest legal harm reduction programs in the country. We started slinging needles in 1989.
Ooh.
I know. We're like the second oldest in the country that legally we're operating. And I called that out specifically because drug users were taking care of each other and saving each other's lives illegally long before anyone was doing it on the up and up. Just as drug users today are taking care of each other in not legal overdose prevention sites.
Yep, we always do. We take care of each other even when they won't.
We take care of each other. And yeah, we provide healthcare and harm reduction services and housing supports to folks in the Portland metro area. I kind of love it there. We do some really cool, innovative stuff around drug users' health and promoting health and safety for folks.
It's one of the organizations that I've, when I even started doing this work, that I'm coming to it obviously from a comedic perspective, just trying to mow down some of that stigma. But I always say to people who are out there doing the real work, not the goofing around on the microphone here, but the real work on the ground every day. Thank you so much from the bottom of my heart. I appreciate it. Love and solidarity to you and everyone at Outside In Portland. And congrats again on 110. We're going to see it to its fullest potential. And it's very exciting to watch in real time.
We're doing it.
I thought it would be like next kids, generations down the road. It's here. It's right now.
We're doing it.
Fuck yes. All right. Well, thank you again, Haven, for joining me. And thank you all for tuning in for your weekly dose.
Hey, America, there's needle users sleeping with your children, with your daughters, with your sons, and with your husband.
Self-Medicated Weekly Dose is hosted and produced by me, Murph Meyer, with support from Pop Culture Collaborative. Our theme song is My Congressman by 15, courtesy of Jeff Ott and Hopeless Records. Original artwork and production design by Diana Kolsky. Thanks so much for tuning in. If you enjoyed the program, you can listen to new episodes of Weekly Dose every Wednesday. Just look for the Murph Meyer is Self-Medicated feed wherever you get your podcasts. While you're at it, subscribe to the Self-Medicated YouTube channel to see new video clips from the show each week. Follow me on Instagram at Murph Meyer. And for some top-shelf harm reduction resources, head over to selfmedicatedpod.com. Also, don't forget, you can call the Weekly Dose podcast anytime to leave me a voicemail message with your thoughts on drugs and the people who use them. Just pick up the phone and dial 443-MK-ULTRA. All right, that's about it for me. I'll see you next week. Love and solidarity. Goodbye.